So the question was, is it instinctive for a baby to breastfeed? So yes, it is instinctual for a baby to want to breastfeed or to seek out the breast. Obviously, your baby is a mammal, and all mammals' biological response after birth is to go straight to the breast. What can sometimes happen if there are any disruption to the order of things, so any disruption to anything but physiological birth, and that can sometimes even be small things, but usually it's things like interventions in labour and birth, particularly things like forceps or caesarean birth, or there's any separation between you and your baby shortly after birth, or any medical procedures such as if your baby needed to go to special baby care unit. Anything like that can interrupt the instincts of your baby, can interrupt that biological response to breastfeed in those initial moments. Or babies may be more sleepy, or they'll kind of shut down, their sensory nervous systems will shut down shortly for a short while. However, with good support and with remembering your 3 keeps, which is keep your baby fed in some way, keep your baby close if possible, and keep your milk supply going. With that good support, you can then get breastfeeding usually back on track. So it is important to remember when you're thinking about what type of birth you'd like. There are certain birth choices or places where you can plan your birth that may have greater impacts in terms of breastfeeding. So, for example, home births tend to have a much higher rate of breastfeeding initiation, and that's usually part of the reason is because there's that physiological process in place that's not disrupted. And, for example, mums who have medication in labour, such as like diamorphine, or mums who've maybe had a caesarean birth, are perhaps going to find that their babies might be a bit more sleepy, might not breastfeed as easily. However, saying that, many babies that have been born in this way, many mums of babies who've had different interventions or even needed that special care, have still gone on to breastfeed successfully. So it's certainly not it's not all lost, and that's certainly something that is important, but to seek support with if you do find it tricky. One of the ways you can help your baby to initiate breastfeeding in the first instance and to find it more easily and to really honour their instincts is to think about and to research things like the 4th trimester, to learn about what your baby's instincts and cues look like. To think about things like scratch mittens. When they have their hands covered, they're not able to fully follow their cues and instincts. They usually use their hands to kind of smell out, smelling the amniotic fluid, to crawl up their mum to initiate breastfeeding if there is no disruption. Not all babies will do that, but many will if given the chance and there hasn't been much intervention and change. And another thing to bear in mind is to think about skin to skin, and how when your baby is skin to skin, it triggers more of their reflexes to breastfeed, and it gives them more of an opportunity to seek out the breast. So there's lots of different ways you can really increase the chances of your baby's natural cues and instincts, even if you have had a difficult or challenging start with your baby. There are things you can do to help them to really get things back on track if you're finding it difficult. Do all babies instinctively know how to breastfeed? Although, as I've explained, it is very much instinct for babies to breastfeed and to seek out the breast, and there may be ways that may be challenging, the babies are still learning, and when babies are born, they've done a huge amount of learning in the womb, but there's still a lot of learning and development in their brains to do. And of course, it is a whole new experience for them to be outside of the womb and taking in all the sights and sounds and smells and everything else going around. So there is a lot for them to learn. It is a learning process, even though it is an instinctual biological response. It is also to do with their brain development, and of course, as we know, the more you do something, the easier it gets. So the more they practice, and they do practice a lot in those early days and weeks, the easier it does get. And that's the same for you as well. So when you're breastfeeding your baby in those early days and weeks, you may well think, how am I ever going to get the hang of this? Or, when will it be I don't have to be looking down, holding this and thinking about it? When will it become second nature? And it does, that does happen. But it is a learning process for both of you. And the way I think about it is to think about something like Strictly Come Dancing, when even the professional who may have done it before takes on a new partner, they together have to learn the steps, and it may be a new dance each time. So they have to together then learn that, rehearse it lots and lots to be able to then perform it well. So I often think that breastfeeding is a little bit like doing a dance, and it's a partnership. So if you think about it like that both of you are learning together, it's not that your baby knows what to do and you don't, and it's not that you know what you're doing and your baby doesn't. It's that together you are learning.